Good evening and welcome to Viewpoint. Together with experts and newsmakers, we make sense of the week's biggest issues and stories. I'm Barnaby Lo. In tonight's conversation, the Greater Manila area nearing the end of a 2-week lockdown, but the current COVID-19 outbreak remains at an alarming level. Hospitals are still overwhelmed. Vaccination has not caught up with the rate of infection. The desperation, it seems, has driven many Filipinos to look for alternatives for prevention and treatment, with no less than a lawmaker, Anak Kalusugan Representative Mike Defensor, offering to distribute an unapproved drug. The Health Department and the Food and Drug Administration had warned that Ivermectin has not been proven to treat COVID-19. But later on, the FDA issued a permit for the compassionate use of the anti-parasitic drug to one hospital. The FDA has also allowed the use of the COVID-19 vaccine by the Chinese pharmaceutical company Sinovac for seniors, citing the country's high transmission and the limited supply of vaccines. The agency halted vaccination of the United Kingdom's AstraZeneca jabs, however, following reports of rare blood clots. All right, and joining us on this wide-ranging discussion on our COVID-19 situation this Saturday evening is the former medical advisor, or a former medical advisor, to the Interagency Task Force on COVID-19 Response, Dr. Tony Leachon. Welcome to the program. Good evening.
Good evening, Barnaby. Good evening, everyone.
Thank you so much for being here with us tonight. There's a lot to talk about, so I'm not going to waste any more of your time. I'm going to go ahead with, because, this is already almost the end of our 2 week ECQ. So I was wondering what your assessment is. Do you think that this ECQ, the 2 weeks that we've had, has been effective in slowing down the spread of the virus and especially the new variants? Because Okta Research just came out with new figures saying that the reproduction number has gone down a little bit. But I don't know if that means anything really, because to me, when I see the case bulletins of the Department of Health, nandun tayo sa 9,000, 10,000, 12,000, and then the hundreds of deaths. So, I mean, am I missing something?
Well, I think the metrics of success cannot only be defined by the reproduction number. By definition, when you mean kasi reproduction number, that is the transmissibility rate or the propensity to be contagious. And we know that if it is less than one, less contagious, and more than one, it means increased transmission and contagiousness. But I look at the other parameters based on the DOH bulletin. I look at the number
Mm.
of cases each day because that's the one that is more important to me, particularly the active
Mm.
cases, because this would be the one that can actually infect or transmit the diseases. Number two,
Mm.
I look at the positivity rate, which is actually defined as less than 5% by the World Health Organization. This is the number of positive cases over the number of tests. I look at the number of testings, and to me, it's anemic right now, considering during those times when I was at the National Task Force, we were doing this at around mga 40,000. Pero ang range dapat in a search like this, of this magnitude, should be in the range of 50 to 100,000 per day. And then I look
Mm.
at the deaths, and the usual Malacanang press statement is that the case fatality rate is low. Ang pag-compute kasi nun is usually the number of total deaths over the number of cases. So to me, misleading kasi yan eh. That is the
Mm.
defense eh. And sasabihin we're lower than the global rate. Kasi ang denominator mo is actually huge kasi yung number of cases eh. Let's say, right now we have 14,000 deaths over, let's say, 108, 150,000. Siyempre diluted dyan, 1.7. What is
Mm.
important is the absolute death, particularly during the last 2 weeks. Yan ang mas
Mm.
importante, absolute death. Kasi
Mm.
ngayon ang overwhelm ng healthcare system natin itong last 2 weeks. So if we will take into consideration the CFR, that will take into consideration also yung medyo mababa yung cases mo the whole year round. So madaya yun. So dapat you have to base that on the number of cases per day, uh, tsaka yung deaths per day. Malalaman mo ngayon. And then I look at also the ICU occupancy rate. Kasi kung puno ang hospitals mo, eh di dapat wala kang tent. Hindi nahihirapan mag-admit. And right now, we see a lot of deaths. Ang Facebook nga and Vibers and Messengers have become obituary
Yeah.
pages for all of us eh. So I think underreported pa yung deaths na yan kasi ang pag-report niyan is the positives, RT-PCR mo. Eh paano? In some scenarios, eh, hindi naman nakakapag-swab test ang mga
Mm.
pasyente kasi wala silang means or they die in their houses. Tsaka yung deaths din, underreported din yan kasi sometimes dahil namatay sila of other cases pero hindi mo alam pala may COVID pala siya. So these are the cases, no? So I think I would not rely on the reproduction number na bumaba. Started with 2, naging 1.9, then 1.6, then 1.4. But essentially, isang metric lang ang reproduction number natin. And I don't rely much on the R naught, but I rely on more comprehensive metric of success.
Actually, some people have pointed out na parang the math doesn't add up kasi the bulletin, the DOH bulletin always has something like 98% mild cases. And then you have like almost 2% case fatality rate. So saan yung 2% and yung 2% na namatay is yun lang yung nag-add dun sa sa mild cases.
Pero Barnaby, misleading din yan eh. I'll tell you why, but misleading eh. Kasi pag sinabi mo kasi 98%, okay lang yan kung kukonti ang number of cases mo. Pero if you have kaya worse ito than last year and worse itong surge na to than the July, August because you have a wider base right now of people with COVID. For example, ng July, August, if you look at the graph, 6,000 yung peak niya eh. I don't think na-reach na natin ang peak. The highest na so far we have is 15,310. But look at the positivity rate natin, pataas pa. And the active cases natin is 180,000. So it means to say, a lot of people there in ground zero, ang dami niyang active. So ako hindi ako nagbe-base yan. Ibig sabihin, kung 98% nga yung mild mo, 2% siya. But in terms of absolute numbers, yung 2% niyan, maaring hundreds yan. Or by the... yan ang pag-analyze ko dyan. I look at the absolute numbers eh.
Actually sa akin, Doc, yun na lang nakikita ko sa Facebook tsaka yung mga nadidinig ko. Because last year, wala akong madinig na mga people in my circle who got COVID. But this year, I know people in my circle who got COVID or who have COVID right now. So,
Barnaby, ako na lang I'll tell you. My practice is internal medicine cardiology. Kung magte-telemedicine ako ng 20 a day, dati nun, 80% yan hypertension ng heart disease. Right now, baliktad eh. 80% ang telemedicine ko, COVID cases, and they are in clusters. Number 1. Number 2, this week, 3 ang pinirmahan kong death certificate in the house. So, ibig sabihin, they die in their houses, walang pumipirma. So, to get that kind, so it's a microcosm of the whole society na nakikita ko. Kung ako ay hindi infectious disease, and then napupuntahan ako ng mga pasyente, how much more yung mga infectious disease ang nakikita nila? So, ganun kagrabe ang situation because walang napupuntahan yung mga pasyente infectious disease at they go to other specialty just to get that kind of attention. At walang pumipirma ng death certificate kasi ganun kakonti na yung doktor measuring that with the ratio ng mga doctors natin ngayon. Really, this is really unbelievable and I think we're on the brink of collapse ng healthcare system natin kung hindi natin mababawasan itong number of deaths. The number of deaths are staggering for the last 3 days. Ngayon lang ako nakakita ng almost 200 per day ang average Oh my God, ang laki nun.
Yeah. But when they compare our situation to, say, Brazil or France or Germany and say, Brazil has 3,000-4,000 deaths a day and we only have 200-300 deaths a day. I mean, how do you react to that?
Ako, nag-comment na ako dyan Ang unang-una kong comment dyan, una-una, there are G7 countries or G20. They have invested so much in healthcare. Kaya they can easily bounce back These countries, yung mga Germany, naka third wave and fourth wave na sila. Baliwala lang yan Kasi ang yaman nila Kahit sila mag fourth wave. Tayo, we cannot afford another wave pa. Kasi nga, hindi nga tayo makapagbigay ng ayuda Kaya nga ang UK was on lockdown for 4 months. Hindi iniinda. Japan, ganun din. Hindi nila iniinda because they invested so much in healthcare. America, grabe during the time of Donald Trump, the cavalier attitude. Lumuhod ba ang Amerika? No, because they have lots of resources na sa kanilang bakuna. Kaya when we compare doon, natatawa lang ako kasi you always compare yourself with you. Eh kung ano yung country mo, yun ang I don't compare myself with another person. I-compare mo yun. Pero when you compare naman yourself with the ASEAN neighbors, ito match kayo. Let's say, bakit tayo number one in cases in Asia? And then, huli tayo sa bakuna. And poorer countries perform very well kaysa sa atin. Imaginein mo, Bangladesh, Pakistan, Myanmar, Cambodia, na-flat nila yung curve. Ang Myanmar nga may gera and yet nakapagbakuna sila. Ang Vietnam, mas mahirap sa atin, di hamak by 10 times ang GDP nila. Pero ilan lang yung cases nila. So what I'm trying to say is it's not about the hugeness of the country. It's not kung mahirap yung country mo. It's actually leadership and strategy on science.
Okay. Balik tayo dun sa question lang. So, do you see any benefit from the 2 weeks of ECQ? Will we see it next week, or maybe we'll see it, sometime in the next
No.
2?
No, I'd like to quote si Albert Einstein. I'm reading Albert Einstein kasi ang galing-galing niya. One particular quote is doing the same things over and over again and expecting the same result. That is insanity. Kung gagawin pa rin natin yung ginagawa natin ngayon, di natin kinokorek yung testings at ayaw nila makinig for a year na, that mass testing is not testing the whole population but a certain portion. And nobody's reading the ano talagang definition. The International Monetary Fund paper, nagsabi 10 to 20% of their entire population. And then dapat sa ground zero lang or areas na targeted mo. Alam mo pala, for 1 year, 8.27 lang ang nagawa natin. Imagine mo, ang liit nun. So for 100 million, dapat nagawa tayo ng mga 20 million in 1 year. Nagawa natin 8 million lang. Ang testing is the cornerstone of everything. Kasi pag hindi mo na-test yan na positive, hindi mo siya mako-contact trace, hindi mo siya ma-isolate, hindi mo siya maka-quarantine. So, kung ganito pa rin ang gagawin natin, mababa ang testings natin, forget it. Ang isa pa, contact tracings. Ang contact tracings, nag-give up na si Mayor Magalong, nagkasakit na nga eh. Ang ibig sabihin, namit na niya in congressional hearing that the average should be, ang ratio should be 1:37 and 1:3 lang tayo. Family contact tracings lang nangyayari sa atin. So, kailan pa natin gagawin in terms of improvement or enhancement of the contact tracings? Not in the middle of search tayo. I heard one undersecretary of the DALG, they're hiring pa ngayon. That's a 2-week course na ite-train mo pa sila. So, wala yon. And then the ECQ, ang physiology kasi niyan for the audience of epidemic is to slow down the virus. Kaya last year, nakatira ako sa Commonwealth, dapat 15 minutes lang, okay na eh. But when I go to work ngayon, from my hospital in Manila Doctors, it will take me about 1.5 hours to 2 hours. Dati kinukuha ko lang yan ng half an hour. Ngayon sa Camp Aguinaldo, mahirapan ka siguro kung makarating ka ng 1 hour. So the ECQ right now, in the strictest term, is not an ECQ. I don't think it's an ECQ.
So you don't expect the same results from the ECQ last year? Because evidently, we got some good results from the ECQ last year. To
Ang
be
ganda,
fair.
if you see. To be fair, flat ang curve natin from March to July. Nung nagkaroon lang ng opening and then nasabayan ng variant na 614G, doon tumawag July and August ang medical community ng timeout. Remember that? So naalala ko yun kasi they requested for, the HPAC requested for an ECQ, but what was given was an MECQ, pero effective pa rin at nagkaroon ng downward trajectory nun. Even with the typhoon, even with the holiday season, even with the Nazareno, even with the Chinese New Year, okay ka pa. Until nagkaroon ng moves ang economic managers na to open cinema, and then 10 to 15 papasok sa mall. And then they did not bother about the variants kasi pag nag-travel ban ka na naman, wala na naman tourism. So in-ignore nila yung travel ban kahit nandun yung B117 at saka yung 1351. So nakapasok ngayon yun, right?
Yeah.
And then buti na lang, in-overrule ng President on March 1 because sabi ng President, wala pa tayong bakuna, so we cannot afford an MGCQ. Eh buti na lang. Kung hindi, lumabas kasi first week ng March, tumaas ng
Should,
tumaas na at to this present point.
so should the ECQ be extended?
Well, kung ang ECQ nilang sinasabi ngayon na ECQ, I don't think it's effective anymore. Kasi ang ECQ nila mistiso. I think we're doing an MECQ right now. Ayan ang tingin ko, sorry Barnaby. But I don't think we're doing a rigid ECQ. And my assessment is an MECQ rather than an ECQ. Kumbaga, is in the words lang. Pero I think makikita mo naman as you go out lots of vehicles, lots of people on the road as compared with last year. And I would say hindi yan tunay na ECQ.
Okay, so then having said that, what should be done now then? I mean, 'di ba? Parang this is one of the biggest
Okay.
arsenals, weapons in the arsenal.
Ako, I personally believe dapat talaga ECQ siya. But kasi kaya lang naman iniiwasan na lang is ECQ, and then they made this mga play of words. Nagkaroon tayo ng mga buzzwords na NCR bubble, circuit breaker, because they want to avoid kasi the word ECQ and the stricter quarantine because of the ayuda. And ganun na nangyayari pag nag-ECQ ka Eh di in my heart, I'm sad kung ECQ kasi that will mean ayuda and lots of essential workers hindi makakatrabaho. Ngayon, kung talagang wala tayong pera at parang MECQ na rin, di MECQ mo na siya. Ang problema ko lang, the essential workers kasi sila yung main source kasi ng new cases. And if the essential workers, yung 20 to 40, will not behave properly in terms of your health standards, they're the ones naman infecting their beloved elderlies at sila yung namamatay based on the data presented by data analytics experts. Yung 50 and above 80 would comprise more than 50% of the mortality. Saan manggagaling yun? Nakakulong sa bahay yun So the only ones that can carry that in the house, unintentionally, hindi nila sinasadya, are the essential workers going to work Yan yung dynamics ito. Ngayon, if the IATF will not be able to diagnose this, at they will allow, syempre they want, I can see the Secretary General Carl Chua on the headlines na yun na. Okay naman MECQ, but how do you protect the essential workers for not being infected? And then also the family members. So, doon dapat pumunta ang policy making nila if they want really that there's a balance na economy and health, and basically MECQ.
Right. So kung MECQ nga, and the economy is half open, and you're saying all these essential workers are potential sources of infection and transmission. And I will analyze what you've said so far. So okay, wala tayong choice because walang pang-ayuda. So our next best choice is to MECQ. But what you are saying is, kailangan, because wala na tayong choice, ang kailangan nating paigtingin is testing and contact tracing.
Right.
Tama yung analysis.
I got this idea from a Twitter. I'm a fan of this particular guy. The name is Dr. Michael Bina from Harvard Medical School. And then epidemiologist siya. Siya yung proponent ng rapid antigen test. No more lockdowns or even vaccines kung wala ka. Ang key daw is rapid antigen test at home. And kung makukuha man diagnosis mo for 15 to 30 minutes, you have signs and symptoms. And then isolate yourself, test yourself sa bahay. And then do the contact tracing and the isolation and the quarantine. Ibig sabihin, every or every American citizen, kasi America siya, but every Filipino citizen, by having a ramping up of the rapid antigen test rather than the swab, is matagal. Kung meron ka niyan in the offices sa anteroom bago pumasok, or meron ka at nagka-symptoms ka, isolate ka na kaagad sa bahay ka, magpagaling ka, so that hindi ka na makakahawa if you're the essential workers. Yan ang solusyon. And I believe
Mhm.
that kung if the government can provide 100 test kits at doon i-realign ang money for the testing, you don't even need a contact tracing kasi it is next to impossible na makapag-contact tracings ka na. It's a waste of money, it's a waste of time na mag-train pa ng contact tracing. Ang magko-contact tracings na Pilipino, makikita mo, let's say, I met Barnaby kanina, I met Paul, oh,
Mm.
I'm positive right now. And then, I'll talk to my wife, oh, okay, lalapit. And then, I'll isolate myself sa bahay, dun ako. That's the way to do it eh. And yun ang
So in
kanyang
other words,
concept.
to empower the ordinary Filipino to be able to do it ourselves.
Exact. Ourselves. So I believe in the concept that opening the economy, as long as the essential worker, libre ang face mask niya pagpasok niya ng building, i-impose na yon. Face shield, sagutin na ng company yan, sagutin na ng gobyerno yan. Alright. Tapos, yung rapid antigen test, pwedeng ikalat sa bawat barangay captain. Meron ding inspiration ako na derived from this particular congresswoman. Ang talino nito eh. Dito ko rin kinuha, tinatahi ko yung kay Dr. Michael Mina, kay Stella Kimbo. Because si Stella Kimbo proposed a household lockdown. So iniisip ko, marrying that particular concept of Dr. Michael Mina from Harvard Medical School of empowering every American citizen or Filipino citizen to be able to test themselves. So sila na magko-contact tracing, sila mag-isolate. Pero sa kanya naman, ang lockdown mo sa bahay lang. And then, empower the barangay healthcare workers to bring the ayuda to their home, and even the testing nandun na. Para may control ka. Kasi siyempre, pag binigay mo yan sa slum areas and other, baka mawala lang yan. Ngayon, kung nasa barangay health workers ka,
Pero Doc, kailangan pa
ha?
rin ng ayuda. Kailangan pa rin ng ayuda because I've heard stories of they hesitate to get tested and they hesitate to isolate kasi mawawalan sila ng kita. So the choice is between mamamatay ba ako sa COVID o mamamatay ang pamilya ko sa gutom. So yung
ito
ayuda
kasi
pa
yan
rin.
eh. Oo. Yan naman I agree with Congressman Stella Kimbo. Kailangan kasi bigyan ng ayuda kasi hindi sila makakapasok. Dapat paid sick leave sila eh. And the president naman as the power based on the constitution right now or sa Senate and Congress to realign money. So realign nila money sa ayuda, sa testings. Yun ang gawan nila. Kasi pag nagawa nila yun, solve ang problema. Matutuwa pa dyan ang economic managers. Kasi I don't think a whole government approach, top-down, gagawin yan. It's a huge country para gawin mo yan eh. But what we can do right now is empower the citizen through the help of the LGU. That will be easier. Tapos, hindi pa natin dinadaya ang sarili natin na hindi pala tayo ECQ. We're actually basically MECQ. Yan ang tingin ko. We're MECQ right now. Kaya, ang nangyayari, demotivated yung Pilipino. Akala kinukulong sila. Pero in reality, nakakalabas naman talaga sila.
Actually, I know doctors who sometimes don't anymore have their patients do RT-PCR and they just do the antigen, and if antigen plus the symptoms, parang why need to do RT-PCR? So parang hindi din yata nasasama sa bilang yon pagka ganun, Doc?
Yan nga eh. In fact, na-articulate ko na ngayon sa Facebook live ko eh. Dapat gumawa na ng guidelines kagad ang Department of Health. Kasi ang gold standard is the RT-PCR swab eh. And then bibilangin nila yung cases eh. Dapat, ibilang nila dapat yung antigen plus symptoms. And then that is equivalent to a case. Para hindi natin nadadaya yung sarili natin. At the same time, pag may namatay, i-record natin yung number of deaths. Kasi the more nating i-hide dyan, natawa nga ako last 2 weeks, may nagre-report na puno yung hospital, namatay sa akin 3, dalawang record ng Department of Health. Imagine mo, 2. April, sabi ko, dami na namatay, 2 pa rin. Kaya unbelievable. So, hindi ka na nagtatrust. So, kailangan ngayon, ang gawin nila, linisin nila yung data management nila, ayusin nila yan, put a lot of encoders, and find out kung paano nila mamemery to. Kasi may saliva pa. O, paano
Mm.
yun eh? Ito yun eh, dapat yung saliva, yung antigen, at saka yung swab, lahat yan mare-record. Mag-decide na kagad ang Department of Health on how do you record it. Para malaman mo talaga yung number of cases mo.
So in other words, our situation is even worse than it looks when you look at the numbers. Uh,
You know why? I'll tell you why it's worse than last year. Number one, you are seeing right now, hindi lang COVID cases. You're seeing also non-COVID cases. Ang dami, Barnaby, na stroke ngayon because for 1 year, hindi mo na-adjust yung hypertension medications. Ang dami
mm,
ngayon, pupunta na lang sa'yo, a-angiogram mo na lang. Ang dami ngayon, dati maliit na bukol, but because they waited for, nag-metastasize na. I had one referral coming from a surgeon, bilateral breast cancer ang mastectomy niya. Biro mo nakakaawa yun. And then yung sugar nung isa tumaas, na dati ang kidney function test niya marginal, pupunta na sa'yo, nagda-dialysis na. So we have right now a double pandemic. You see an epidemic of COVID cases, and you have also an epidemic of non-communicable or lifestyle diseases because let us not fool ourselves during the time na we're on lockdown. Hindi tayo nakapag-exercise, hindi nakapag-diet, hindi nakapag-check. So all our numbers in terms of our blood chemistries, ano yan, abnormal yan. And therefore,
yeah,
nagkasakit yun. Ang nadadali ng may COVID ay mga patients na with comorbid conditions eh. So actually, the lifestyle diseases actually nag-aggravated the COVID conditions eh.
right, right, right. Okay, and this desperation, of course. I'm going to move the discussion forward because we don't have that much time left. But so this, this desperation that we are seeing right now, it seems, it appears, but correct me if I'm wrong, is driving this belief on alternative treatments and preventive treatments. And ipangalanan na natin because we're talking about ivermectin,
Right.
of course. Right. So, I mean, do you understand what would have been the basis for the FDA approving compassionate use permit for ivermectin? Because for the longest time, the FDA was saying, well, there's no proof that FDA and DOH both saying that there's no proof until now. They say it, pero that there's no proof that ivermectin can treat COVID-19. Not enough proof yet. If we are going
Right.
to be safe about it. But then suddenly, meron permit for compassionate use for one hospital.
Correct. Alam mo, Barnaby, ang FDA sana naging bastion siya eh, in terms of compliance eh, and adherence to research and development eh. Kaya lang, it has weakened its position. Hindi siya naging firm eh. While on one hand, sabi niya wala naman masyadong efficacy and safety data and we're waiting for the ongoing randomized controlled trials abroad, and 28 trials are right now ongoing. We'll wait for that. And then they cited also the US FDA not allowing it, the World Health Organization, and then the Department of Health, and then in coordination with other reputable medical organization, the PSMID, the HPAC, and the PMA, and the Philippine College of Physicians. Okay doon, ganda. Sabi ko, wow, ito talaga ang sinasabi ko. Pero they have weakened their posture by allowing compounding and availability of this particular compound. Mistiso ang nangyari eh. And then, ang dagger is that when they allow compassionate use, when compassionate use should be based also on science and research and correct data. Oh, kasi na weekend eh. So sabi ko, kaya nga nabutasan ka ngayon. So FDA
I mean, but it's only for
actually,
one hospital. It's only for one
yeah,
hospital.
right, but it can be a precedent. Ang ibig ko
Mm.
sabihin, Barnaby, it can be a precedent eh. It's just one hospital and then one hospital. Kasi sasabihin ng isang hospital, if that one hospital pinayagan, then another hospital, then another hospital. Diba? So, ang point doon, ang sinasabi ko, hindi consistent eh ang paggamit ng FDA ng rules niya. And nakadagdag siya sa problema natin ngayon. Na kasi ito ang reason ko for compounding, but kasi unregistered product yan eh. Now, how sure are you yung efficacy and safety and quality na may maintain in that particular white bottle na hindi mo naman alam kung how many excipients. Ibig sabihin ng excipients is other than the active pharmaceutical ingredient. Ilang harina yan o ilan. In the real world, let's say 90% yung active pharmaceutical ingredient, then 10% in order to bulk the product. How much is the bulker there? How much is the active pharmaceutical ingredient? Granting na may effect itong medication, oh,
Mm.
that's number one. Na, how sure are you about the quality standards niyan? Eh wala eh. Hindi naman yan ma-check ng BFAD kasi unregistered yan eh. Sino mag-check niyan? Number two is the availability. Once you make it available, pwede mo siyang i-private message. Ang concern ko diyan eh black market eh. Once you make it available, anybody can order right now. So how do you monitor yung adverse events niyan? Who would be responsible right now or accountable for the adverse events ng mga pasyente mo? Instead na save mo ngayon yung pasyente, nagkaroon ng false sense of assurance that they will be safe. And then, eventually, after 7 days, may pneumonia na kasi they were hanging on this particular drug na masasave sila. So, I don't want that kind of false sense of assurance na masasave ka. Kasi the usual scenario, sasabihin na, ay, mamamatayin tayo lahat if we will not try on this. That's folklore eh. Kasi we are in this era of technology and advance. There's no room for that kind of medical adventurism. Ako I'm a law-abiding physician ever since, and the patients would only trust the doctors based on the medicine that you will give. Ngayon, kung unregistered dyan and by law, by PRC and the Hippocratic Oath, how can you in conscience, legally, you are bound by that eh. So, both legally and morally na parang meron kang liability.
So you're
And sa
worried that
Hippocratic,
you're worried that this compassionate special permit would somehow legitimize the claims on ivermectin.
yes, kasi you will encourage your RX coming from physicians eh. And ang mangyayari niyan, observational studies yan. Hindi siya one of the lowest form of test yan eh. Though I understand the sentiments of my colleagues there eh. Kaya lang kasi, dapat we are governed by rules and laws eh, and guidelines eh. Now, if we will use this, and a lot of patients would trust their doctors. And I believe some of the doctors na ganyan are, prominent doctors eh. Nagkaiba lang kami ng ideology. Ang kaibahan lang ng ideology namin, they're willing to explore other opportunities kahit hindi registered ng FDA. Doon naman ako hindi. I'm a law-abiding citizen. I'm a law-abiding physician. So whatever is approved by the FDA, susundin ko yun. Kunyari, eventually, ma-approve yan, I will use Ivermectin. Pero at this
Okay,
point
but
in
the
time,
question is, do you even see the potential of ivermectin in COVID-19 treatment?
me, no.
No.
You know, why? Kasi in my past life, no? In my past life, as sa pharmaceuticals, pagka ang isang company like Merck, sinabi niya na walang potential yan, dalawa kasi when you produce a product eh, unmet need at saka doability. Like for example, in one drug, yung gabapentin, just to stretch yung kanyang tinatawag na patent. Nag-off-label indication yan. Kasi it was first discovered for a seizure na hindi bumebenta. But lo and behold, pwede pala siya sa neuropathic pain, yung mga pain ng diabetes at saka herpes zoster. Kaya lang yung patent niya mag-expire na. So nag-off-label indication until na-discover yung Lyrica, which is pregabalin. Pero naparusahan ang drug na yan by 400 million. So ang off-label hindi pa pwede. So ganun ang mga company. Pag wala na sila nakita ng potential, biro mo in this COVID times, kung talaga effective yung Ivermectin, Merck is the number 2 American company. Di dapat they would try to invest on that. Bakit hindi siya nag-invest? Well, kasi wala. Napiga na ng scientist sila, talagang wala. And for Merck to disown that any effect on COVID, tapos na yun. Or else, gagamitin nila all their might and power to produce a particular compound that will actually be effective in the most famous as well as pinakamabentang sakit. Ganun yan eh. You have to market it right now. So biggest market, the biggest market is COVID eh. And suddenly Merck, nag-back out, wala talagang makikita. And that's maybe true.
Just to go deeper into the science, ano ba yung mga pwedeng side effects nitong ivermectin if taken in yung sinasabi nilang doses na para sa COVID? I think 15. I'm sorry, I don't remember. 15 milligrams 3 times a day, I think. Yeah.
Ang ginagawa kasi dyan sa earlier studies, kaya may phase 1 and phase 2, doon tinitingnan muna yung efficacy and safety. Then, sa animals muna titingnan whether they develop side effects sa liver and then sa kidneys. But in literature, ang nakita nila is neurotoxicity. It can cause brain damage. Ngayon, after the ma-prove mo sa animals na safe yan, you go to 100 cases muna and check muna yung liver again and kidneys kasi these are the organs usually damaged. Right. And then after that, okay pala in 100. They will now move to 3,000 to 5,000 cases. They call it the phase 3 studies. Yan ang ginagawa ngayon, yung phase 3 studies. So, i-check yan usually yung organs, liver, and kidneys, and some of the vital structures. Ngayon, pagka nag-complain niya ng headache, then i-scan niya, titingnan niya, para malaman mo. That's the only time pagka sa phase 3, at effective siya in humans, randomized controlled. Kasi ang nangyayari kasi, effective to sa akin, pero gumamit ng vitamins, gumamit ng linwa, alin dun sa gamot na yon versus placebo ang effective. So dapat, isa lang siya, ivermectin versus placebo, para malaman mo, effective talaga siya. Pero when you have, let's say, 10 medications, let's say 5 of that vitamins, the other one a linwa, and then the other one is ivermectin, how sure are you na siya ang nakagaling dito? Alam mo naman, 90% of COVID, self-limiting, even without medications, gagaling yan eh. God heals eh.
Yes. Pero on the side effect, on the side effect, you're saying that the worst is brain damage.
Brain damage, neurotoxicity.
That is a pretty bad side effect.
Pretty bad. So, magsi-seizure ka niyan eh. Magsi-seizures ka niyan, then you go to loss of consciousness, sensorial changes, and we don't want that to happen. Yan ay nakita na natin dun sa kanilang product label eh. May product label kasi yan eh. So even in the vet, makikita mo na dyan kung parang animal, di ba? Ginagamit niya sa animals, sa horses, or whatever. So, ita-transpose mo lang yan sa humans eh. Kaya ina-adjust yan eh. Yan ginagawa in the dose ranging. So, how can you compound something na hindi ka licensed pharmacist to start with? So, dapat, kaya nag-a-apply ang big pharmaceutical company so that they will be able to help out kung talaga ang dose niya na karapat-dapat for that particular person. And you need a licensed pharmacist, a clinical trial, anong dose bang pwede. Kaya ang tawag dyan, dose ranging. Kaya merong 250 milligrams, may 500 milligrams, let's say atorvastatin, you have 10 milligram, may 20, may 40, may 80. Di ba? Titigil ka sa 80 kasi alam mo, above that can cause side effects na. Right? Kaya, yun eh. That is what we call dose ranging. Pagka dito na, let's say nag-100, so 10, 20, 40, 80. 100 hindi pa pwede. Kasi ang side effect ng statins in the market, liver damage. tataas ang SGPT mo. So kunyari, when you use 100, tumaas, no, tigil ka na. Hanggang doon lang ang efficacy mo, andun din yung safety profile mo. Or else, pull out ka sa market later on when you actually expose a lot of people, let's say into the millions, doon ka magkakaroon ng signals.
Now, how does this affect naman po our vaccination efforts? Because we already know that we have a vaccine hesitancy problem, and this is outside the fact that we have limited supplies of vaccines. And now that ivermectin has come into the picture, and a lot of people believe in it, and a lot of people believe in it as prophylaxis. I would say, as a layman, pag prophylaxis, if you believe in it as a prophylaxis, baka hindi na magpabakuna. Am I am I analyzing this right?
Hindi. Ang analysis ko kasi is like this eh. Tatlo kasi ang reason yan eh. Ang first reason is medical adventurism, katulad nung sa hydroxychloroquine. I think the proponents of this one believe also on the hydroxychloroquine during that time. Until formal studies have been done by the WHO and other academic institutions na nagkakakos pala siya ng cardiac arrhythmia, then tanggal siya. And even up to now, dami pa naniniwala sa HCQ eh. The second group naman are the businessman na gusto nila there's a quick fix right now so that they can open the business right away. But since the vaccines are not available right now because hindi na late tayo nakapag-queue up and we are having problems right now with the best vaccines in the world because of vaccine nationalism. Ang nangyari ngayon, walang natira sa atin. So they want to open the economy. And they want to hold on that hope, the ivermectin na pinapromise. Right. And then number 3, there are persons believing in integrative medicine. Iba yun eh, it's a branch of medicine. They advocate mga supplements, mga ganon. Ito yung mga group na yon. So, iba't iba eh. And these are, I cannot blame them kasi ganon yung kanilang ideology eh. Kaya, we believe that. Kaya lang, at the end of the day, ang pwede maka-break ng deadlock is the FDA. Kaya nga siya regulatory agency. Kaya nga sinasabi ko, when politicians nag-take over sila on this, they're not the first person na dapat natin paniwalaan kasi hindi naman sila nakapag-aral ng medicine eh. Ngayon, kung two opposing medical communities nagkakaroon ng deadlock, who's supposed to break it? Dapat the highest regulatory agency. Kaya nga tinayo ang FDA to evaluate that eh. Now, if we don't honor that, then wala na. Magiging wild west tayo. Wala na. Magkakaroon ng medical anarchy. Magkakaroon ng medical anarchy.
Are you saying that FDA's decision to grant compassionate use permit for ivermectin to one hospital was a political decision?
I think political siya and pressured, tingin ko. FDA has been under a lot of pressure right now, and I think it's one of the mistakes by granting that kasi it adds legitimacy right now to the claims eh.
Pressured kasi by
a lot of sectors, 'di ba? You see that in the newspaper, ang laki ng position statements by group of businessmen, group of doctors. Kita mo that particular position statement. And I cannot blame them kasi, the economy has been, on a roller coaster mode for the longest time eh. And when doctors speak, lalo na, ang gagaling din ng mga doktor na mga yan, so they will believe that, no? So, wala naman akong issue about it eh. Kaya nga, I'm hanging on and relying on the FDA na i-exercise niya and flex their muscles talaga on the real issue, kung talagang yun talaga. Pero right now, sa tingin ko, mistiso yung ginawa eh. And it's really saddening kasi nalilegitimize right now yung pinaglalaban. Na-watered down yung kanyang position on the efficacy and safety.
Okay, just real quick then, kasi overtime na po tayo. Your thoughts on suspending AstraZeneca jabs because of reports of rare blood. I have to emphasize the rare because European Medicines Agency emphasized the rare blood clots, and then at the same time the approval of Sinovac for people 60 years old and up.
That's a bad decision. Kasi yung rare blood clots present in those countries eh. Nung ni-review yung national adverse event natin na IFIC, wala pala tayong rare blood clots dito present eh. And then suddenly, we compound the problem kasi ang nag-order ng large volumes of AstraZeneca are the private sector and the LGU. In fact, all LGUs in order Astra because it's cost-effective, the cheapest, reputable company, okay ang fridge. Ang private sector, ganun din. In fact, we had a tripartite agreement already with the National Task Force and the vaccine czar in Joey Concepcion and the CEO of Astra in the Philippines. Hinihintay na lang yan, July, and even the LGU. And suddenly, for less than 60, binan mo siya at the time na kailangan natin in the surge. Dapat yan, inaral muna natin kung ano yung position of other countries like Thailand. Inaral nila, a few days lang, di naman nila binan, hinod. Ngayon, ginawa nila, Prime Minister pa at saka yung kanilang hospital chief. And even in UK, nireview ko yung UK, wala silang age-specific restrictions. Though they said perhaps there's a link, pero hindi nila totally binan kasi kailangan nila in their country.
30 and younger, they stopped
Yeah,
giving.
30 and younger ang sinabi ko. Kaya lang sa atin, ang wide yung range natin, less than 60. Kasi pagka pinagbawal mo yan, you want also to protect the essential workers eh. Kasi essential workers, gusto mong papasukin yan because of the economics eh. So, kung mababakunahan yung essential workers na may comorbid conditions, ang nangyari kasi, ang wide yung range ng ating restriction, less than 60. Sa UK, less than 30 kasi they think about the essential worker. Ngayon, in the Philippines, ang may new active cases, 20 to 40. So, may problema yan. Then number two, may halo effect also on the effect on the senior citizen. Kasi siya yung nakaposition for A2 na gagamitin ngayon. Ngayon, pag pinagbawal mo yan less than 60, ang sasabihin ngayon ng senior citizen, siguro unsafe yan. Unsafe yan. Kasi it has halo effect eh. So dapat yan, inaral mo na mabuti. Yun pala, based on the Adverse Event Committee of the Philippines, wala palang reported rare blood in the Philippines. So paano mo ma-justify yan in the era na mas kailangan natin ngayon ng bakuna? So yun pala, ang reason, run out of stock. And suddenly, your decision is to approve your Sinovac because nagtataasan daw ang cases natin. Parang dapat ginawa yung decision yan March 1. Nung time na sinabi for senior citizen hindi pwede, healthcare workers hindi pwede. Dapat pala noon, ginastify na lang na meron palang studies for senior citizen. Not a day after nang sinabi na wala na silang AstraZeneca, parang napilitan lang na Sinovac is for the senior citizen. The timing is bad eh. Though there are studies talaga naman, ni-review ko, particular studies sa Chile na it can be used na sa seniors. Kaya lang, what a timing. At the time na nag-run out of stock ka, na kailangan ng mga senior, ng mga essential workers mo ng bakuna with comorbid conditions, hindi mo pwedeng gamitin. And you're left with only one choice, that is Sinovac. That is something na critical thinking and decision-making process by benchmarking across the globe kung ano talaga ba ang regulatory process. And I don't think we did our homework there eh. So nangyari ngayon, may surge ka, iisa lang ang bakuna mo ngayon. And then, hindi mo pa alam kung kailan ang susunod na shipment.
But from what I'm hearing from you, the bottom line problem here is vaccine hesitancy, that it adds to vaccine, that all these decisions add to vaccine hesitancy.
Yeah, I mean, we set up ourselves to fail eh. Ang nangyari ngayon, tayo ang sumira dun eh, dun sa produktong yun eh. Sayang eh. Kasi ang healthcare workers, marami nag-AstraZeneca. Ngayon ang question nila, what will happen to the second dose? 'Di ba? Sana inisip natin muna yung far-reaching implications before we make that decision. Kung marami namang rare blood class pala in the Philippines, kaya nga may ethnicity eh. There are certain side effects not common in certain countries. Wala akong nakita dahil ang papayat natin. Alam mo yung mga blood class na yan, nangyayari yan in obese individuals, malapot ang dugo, persons who are not moving, huge persons, may fracture, nagko-contraceptive pills. But makita mo, because linear ang frame natin, wala tayong makita. So kung sana meron tayo an abundance, let's say 10 or 20 cases, okay lang, justifiable. But to make that ban at the time na kailangan mo, tapos wala ka palang rare blood class in the Philippines, what kind of decision-making process is that?
All right. Okay. So we're going to have to leave it there. Thank you very much, Dr. Tony Leachon, for joining us once again on this program. If I'm not mistaken, this is your second time on this program. We appreciate your insights and your expertise. Thank you very much. To those who tuned in, thank you for joining us in this episode of Viewpoint. Do catch us live here on Now You Know's Facebook page, Twitter, and YouTube channel every Saturday live at 6 in the evening. For updates on our upcoming episodes, please join our Facebook group. Just search for Viewpoint on Now You Know. Again, my name is Barnaby Lo. This is Viewpoint. Now You Know.